Welcome to Please Me, the award-winning bilingual sexuality podcast bringing you bold conversations and big clit energy. Sí, Please Me tiene subtítulos en español. I'm thrilled to announce that Please Me is the #1 ranked sexuality podcast in the USA and worldwide. And welcome to Season 6. I'm Eve, your host, on a journey from trauma to sexual liberation. Join me and my guests as we dive into conversations around orgasm equality, self-love, body positivity, and essential sex education. Let's reclaim pleasure and close the orgasm gap, one empowering conversation at a time. Last week's two-part episode with attachment expert Bev Middleman explored how your attachment styles shapes relationships, sexuality, and even workplace dynamics, so be sure to listen to part 1 and 2 if you missed it. This week, urologist Dr. Stephanie Zwonitzer joins me for a two-part deep dive into common sexual health conditions affecting both men and women and how to get real help. Huge thanks to everyone who's rated, reviewed, and shared Please Me. Because of you, we're now the #1 sexuality podcast in the US and worldwide. Your support amplifies vital conversations about pleasure, healing, and sexual empowerment. Keep the momentum going, leave a review, share your favorite episode, and help us reach even more listeners. This week, I'm shouting out 5 amazing countries where Please Me hit #1: Tanzania, Peru, Chile, El Salvador, and Hong Kong. Thank you for tuning in and turning up the volume on pleasure. I'm also raising funds for survivors of the devastating magnitude 6.9 earthquake in the Philippines. My editor, who is based there, and her community were deeply affected. She recommended a trusted organization that provides long-term aid to those impacted. Please check the show notes for the donation link. Any support you can give is truly appreciated. Want to ask me a question for the Please Me podcast? Join the conversation on Patreon or subscribe to my Substack newsletter. Both communities give you access to exclusive content, updates, and the chance to have your questions featured on the show. Please Me is for mature audiences, so sit back, relax, and surrender to the pleasure of Please Me.
Your penis is a use it or lose it. You need to exercise it. Just like you go to the gym for your muscles, your penis needs exercise too. So whether you climax or not, if that is a personal thing for you, it's not an issue, but I still want you getting an erection at least once a week, preferably multiple times a week, because we need that stretch of the elastic tissue. We need the stretch of the blood vessels, the outer skin. All of that needs to be exercised to maintain length and girth.
ASN Lifestyle Magazine is your go-to source for sex-positive, sophisticated content covering everything from the swinger lifestyle and adult entertainment to intimacy, wellness, and more. You can read every digital issue for free, and subscribers get access to exclusive content. See the show notes for the link to subscribe and check out their Instagram. I'm excited to share that I now have a monthly column in ASN called Big Clit Energy, a Please Me series. Don't miss it and subscribe today. Hello, and welcome to Season 6 of Please Me, the podcast that aims to destigmatize conversations about sex and sexual health by turning the sheets into our classroom. I'm so excited to welcome Stephanie Zwonitzer to the show, and she is the host of Between the Sheets podcast. And you just heard my intro. It's so similar. We are like right on the same page. She works in the field of urology, where she helps her patients to improve their quality of life in areas of voiding dysfunctions, pelvic dysfunctions, and sexual medicine. So with that being said, I want to welcome you to Please Me. How are you tonight?
I'm well. Thank you so much for having me. I'm excited to be here.
I'm so excited to have you here today. And we had such a great conversation the other day on your show. And
Yes.
So we had to make it happen on my show as well. And so thank you so much for being able to schedule this with me today. I want to talk about the lack of education when it comes to your experience as it relates to male and female sexual health and pleasure. What exactly are we lacking in terms of education, and what do we need to know in terms of sexual health?
Yeah, I mean, there's a couple different levels of that, right? So on a provider level, what is our lacking in education is we don't spend a lot of time on sexual health unless you seek out extra certifications and extra conferences and classes and things like that. So you're kind of briefed on it and more from the reproductive standpoint and the procreation standpoint rather than pleasure and feel good and all of that. We really don't even teach people about all of the benefits of the oxytocin release that you can get with the orgasm. So that's already level one where we're not having enough education. And then you get down to, all of us in our daily lives and the lack of education there. I mean, in school, you're taught basic anatomy, but at least back when I was in school, you were segregated boys and girls and you didn't learn each other's stuff and all of that. And so, really, you're learning from porn. You're learning from friends, you're learning from family members. You're not getting good quality education in regards to how to be safe, how to enjoy pleasure, and not just PNV equals baby, because that's what most of us are taught.
Yes. And, we were growing up at around the same time, I think. And, what they were teaching us was abstinence and,
Mhm.
one partner only, saving yourself for marriage, etc. And really, the landscape of marriage has changed so
Mhm.
significantly in the last 50 years, where, maybe 50 years ago, 70% of the, adult population was married. And now it's way in the 40s. And,
Yeah.
abstinence is just not an option because people are going to have sex. And so
Yes.
if that's what we're expecting people to do, we're really missing the point and really missing their sexual health needs if we're,
Yeah.
if we're missing that information.
Absolutely. When I was going through school, part of my public health class was going into a high school and doing a sexual talk. And I was not allowed to talk about STIs. I was not allowed to talk about sex, like having sex. I was only allowed to talk about abstinence. I wasn't even allowed to talk about safe sex. I mean, it was just that we were so limited. And I'm like, well, what are we even supposed to talk about? Because those are all of the things that we need to be teaching teenagers, especially because they don't know yet, but all levels of adults who are sexually active need to know about how to have safe sex. Whether you have one partner or multiple partners, you need to know about lubrications and pleasure and condoms and all the different facets of a good sex life. And all we're doing is teaching basic anatomy and don't touch anybody till you're married. And then if you do, you have to stay with that person forever. So yeah, there's huge lack of knowledge. We're starting to get better, I think, but there's still so much room for growth.
I agree. I agree. And the STI conversation is rarely had, right? So let's have it
Yeah.
right here.
Okay. Let's do
um,
it.
I think it's really important, and I like to consider myself the face of safe sex. And
Yeah.
so I love talking about STI testing and how there really are a lot of um, spots where we're missing information, right? The STI
Yeah.
testing panels that are given to by our doctors when we go in are
Hmm.
often lacking essential information. They rarely in the United States do oral testing,
Hmm.
and they also are lacking a lot of times herpes testing, HPV testing. So can you just tell me what a typical panel
Hmm.
looks like and what is lacking in that and what we should be asking for in addition to what your typical insurance will cover,
Yeah.
etc.
Yeah, absolutely. Great question. So, if you go in for your annual physical, you're and ask for STI testing. First of all, it's not just given; you have to ask for it.
Yes,
Or
which
if
is
they say, "Would you
ridiculous.
like it?" It is. Everybody should have it, whether you're monogamous or not. We can pick things up in various places with different activities that we do. So, HIV, syphilis. Let's see. If you do a urine test, gonorrhea and chlamydia. If you do a Pap smear, HPV. And that's about it. Really beyond that, we don't even herpes is not part of the standard testing. And that's for two reasons. Number one, it is so common that to some degree we don't even feel that it's necessary because the vast majority of us have it, whether you end up getting outbreaks or not. Some people are just carriers and never get an outbreak. The other reason is the blood test is not very accurate for HSV1 or 2. These can give not only false negatives, but false positives. And so all of a sudden you think you have HSV because this came back positive, but it's not actually there. And then the emotional stress and everything that goes along with that. And is it from this partner or that partner? Herpes, you really can't tell. You could have been carrying it for years and years and years. The nice thing about herpes is it doesn't affect anything besides giving you a rash from time to time. So you're not going to get any organ damage or anything like that. So if you do have it, it's really not that big of a deal. Just tell your partners so they're aware. But it's not part of the regular testing. The best way to get tested for that is if you have an outbreak, go and have a provider swab it, and that will tell us for sure what it is. And HSV 1 and 2, we really don't even differentiate between the two anymore because you can get oral herpes up top and down below. You can get genital herpes down below or up top. So I would always ask for testing. If you have a rash and you're not sure what it is, get it swabbed and figure it out. And then definitely, getting the vaccines and the testing and stuff on a regular basis is super important. Between partners, it should be done, and at least on an annual basis if you're a monogamous.
And what vaccines are you specifically talking about?
Yeah, the HPV vaccine.
Okay.
It's not perfect by any
Mm-hmm.
means, but it does decrease your risk. And it even if you get those levels of HPV, it's been known to decrease the extent of the possibility of cancer. So it would maybe make your cancer less than it would be had you not gotten the vaccine.
Yes, and that's something that is given to girls, right, when they're very young. And that's something that a
Mhm.
parent needs to decide, right? But
Yeah.
how about for boys? Is there a vaccine for boys?
Yes, they can actually get the same vaccine. So it is now standard for all teenagers, male or female. And I believe a lot of universities now are even requiring it on their admissions, just like you would like a hepatitis injection. And so there's a good push for it. Obviously, it's not right for everybody if you have allergies or things like that going on. So certainly talk to your provider specifically for yourself. But it's a great vaccine in regards to a way to prevent cancer.
Absolutely, super important. And I want to go back to herpes because
Yeah.
it's not just a rash, right? There's other symptoms that come along with herpes. Can we just touch upon that?
Yeah, so it's usually pain, itching, burning, and that can start before you even see the rash. And a lot of times that pain can last for several weeks. Those sores get crusted over, and you're highly transferable when you have an active infection, but you are transferable at any point in time. But we have great medicines, acyclovir, valcyclovir, those can help get the outbreak under control.
Hmm.
And if you are a person who doesn't want to transfer it to a partner, let's say your partner doesn't have it and you do, you can take a daily dose of one of those medications. Or if you're a person who gets frequent outbreaks, you can take a daily dose of those medications to keep your outbreaks less.
Yes, and it also actually comes along with flu-like symptoms. So if you're
Yeah, it
feeling
can.
like you have the flu, you may be misdiagnosed with having
Hmm.
the flu or having an upper respiratory infection or something else. But it does go hand in hand with herpes. So
Hmm.
if you're having flu like symptoms, and in addition to that, you're having itchiness or painful or tingling or any of those
Hmm.
things, because it is a neurological
Yep.
um, condition, right? So it attaches to like the nerve. Do you want to just
Mhm.
go into that a little bit?
Yeah, sure. And so it's very similar to the chickenpox vaccine that we had as kids, that can come back as shingles. It's very similar. So it actually lays on the nerves in what's called a dermatome. And so, like, certain areas of your body are going to be more likely to get outbreaks because that's the area that the virus is living on. So just because that's why we have oral and genital, is because that's generally speaking, it's going to show up in the same dermatome that you got it in. But it can move, just not as often. But yeah, they live on the nerve itself, and it is a virus. There is not technically a cure for it, but like I said, we can suppress it pretty good. But you do need to be careful about stress levels, and anything that can really exacerbate flu-like symptoms. on a normal basis can also exacerbate a herpes outbreak. So stress is one of the biggest factors, but it can also be other illnesses. If you are on any immunosuppressants for different disease processes that you might have going on, that can cause an outbreak as well. So, really trying to just decrease your stress and keep your immune system nice and healthy can help with the outbreaks.
Yes. And knowing that when you go to the doctors, they may not test for that. And if that's something that you want to be tested for, also with HPV, right?
Mhm.
You can ask specifically to add those to the panel. And then you can also ask for an oral swab. So, do you want to just talk about why someone would want an oral swab?
Yeah, I mean, the DNA is in your cells and in your saliva, right? So we can test there a little bit more specifically. And that is actually a more accurate test than the blood test for HSV. So a lot of times, if you've done the blood test and it comes back positive, you want to confirm that because, like I said, there's lots of false positives and negatives. So you could confirm that with an oral swab, or if you do get an outbreak, a swab of the actual sore. But yeah, it's much more specific if you're getting the oral swab.
Yeah, and where I was kind of going with that was that STIs can be transmitted through oral sex as well, right? So
Yeah.
there's such
Mhm.
thing as oral gonorrhea and other
Yeah.
transmittable like, infections orally. So getting an oral swab and not just focusing on the genitals is important to have a full picture of your entire body.
Yeah. Yeah.
And is that something that's common here in the United States? Because I know I had another guest on who was from Australia,
Mhm.
and he said that in Australia the oral swabs are actually part of their general STI testing.
Yeah, no, I mean, you really have to seek it out, and then you have to find someone who is comfortable with it, has the right products to do it, knows the right lab to send it to. It's definitely not part of the normal repertoire. I mean, we don't in my urology office, we don't even have those. We would send you to probably your primary care or urgent care to get them done.
Okay, and I'm just going to reference back another podcast that I did with Shameless Care. That was the name of the company. The person, that's not his name, but it was the episode on shameless care, and he has a very comprehensive STI home testing that you can get that includes, a doctor's visit to begin with, someone that's looking at your labs that will call you and discuss the lab results, and it does include an oral swab. So if anybody is interested in that, I will include the link for shameless care in the show notes because I think it's really important that we really have an understanding of our overall health. And if we're
Mhm.
only getting partially tested, we may still be carrying an STI that we can be spreading from one
Yeah.
person to the next if you're having multiple partners, right? So
Yeah.
super, super important.
Yeah, I love that, and how nice is that that you can do that in the comfort of your own home too, and, unfortunately, there is such a stigma still with STIs, and there really shouldn't be. I mean, we all get to have sex, and if you have sex enough, you're probably gonna get one at some point in your life. And most of them are gonna be, your gonorrhea and chlamydia, we're gonna treat it with a quick antibiotic, and, you're done. Does that mean I don't want you practicing safely? No, it just means don't be embarrassed to come talk to us
Right.
because we see it all the time. You are not
Hmm.
alone in that. Still practice safe sex, still do all the things that you're supposed to do. But when you have those symptoms, come get checked out because it's no big deal to us. We see it all the time.
Absolutely. That's so true. And I'm just curious, because for me, like urology means it's something that a man goes to see. What is the percentage of, male clients to female clients?
Yeah, so my personal practice is about 50-50,
Okay.
depending on what you specialize in urology. Obviously, if you specialize in the prostate, things like that, you're going to only see men. Women don't
Men,
have a
right, of
prostate.
course.
But I see both men and women because of the sexual health side of things. So I see men for erectile dysfunction, low testosterone, and then I will see them for prostate stuff and whatever because I do, see them for other things. But my women, I will see them for bladder or uterine prolapse, whether if they're using pessaries or if one of my surgeons does surgery and then I follow up with them afterwards. We'll do pain with sex, incontinence, recurrent UTIs, which a lot of women will end up working through postmenopausal and things like that. So I personally see both sides.
Both
I'm in
sides.
about 50-50. but depending on where you specialize, that kind of negotiates what percentage you're seeing.
Okay, that's great to know because for me, in my experience, I've only ever gone to a urologist with my ex-husband. Like I never really thought to go to a
Yeah.
urologist for my issues, right? But women can also see
Yeah.
urologists. So point taken out there, ladies, if you ever have any sexual health conditions, you can go see Dr. Stephanie or someone like her, right? So
Yeah,
let's talk
absolutely.
let's talk a little bit about low testosterone and how is it diagnosed and
Mhm.
treated, and is there a correlation with erectile dysfunction?
Yeah, so great question. I love treating testosterone. It's life-changing for guys.
Hmm.
So first of all, symptoms of low testosterone: hair loss, weight, fat gain, decreased muscle, decreased bone mass, brain fog. You can have decreased libido, energy, and stamina. It can affect your erections. Now, erections are multifactorial, so testosterone is one of the factors that contributes. So it can help, and it can hinder, but it's not going to be the end all be all for the erection. So if you have low testosterone, to be clinically diagnosed, you have to have less than 300. So 300 to 1,000 is considered normal for total testosterone. Insurance companies will cover you for your treatment if you're less than 300 on two different testosterone readings. That being said, most of us know our guys and what levels they like to live at, and living optimally is not necessarily the same as living medically diagnosed, right? So if my guys, if I have a 29-year-old that's in the upper 300s or low 400s, he is not living optimally. He should still get testosterone replacement, but he unfortunately is going to pay out of pocket because insurance isn't going to cover him. He didn't hit that number. My older guys in their 70s, they still need it for their energy, their stamina, their libido, all of those things, but I might keep them closer to 500 or 600. So we kind of vary throughout the life, and we monitor other things. So one of the biggest things that you want when you are getting diagnosed is make sure you're with someone who knows what the heck they're doing, because not everybody does. And you want to be tested for all of your sex hormones, your prolactin level, as well as your testosterone levels, because we need to make sure that it's just the testicles not producing enough testosterone and not something else going on inside of you telling the testicles not to produce it. Okay. So we want to make sure we're treating the right thing. And so that we can get you on replacement therapy. There's several different kinds. I can go into that if you want to, but baseline is you want to get replaced so that you have better energy, better libido, better stamina, better overall health. The really only downsides to testosterone replacement therapy is it can make you sterile. So if you're real young yet and having low testosterone, we really want to talk through that and see what's going on. And then it can make your testicles shrink a little bit because they're no longer working to produce the testosterone. They're not going to shrink up like marbles. They're just going to get a little bit smaller, and then they're going to stay that way. And then it can, there's mixed research about its effect on prostate cancer. It will never cause a prostate cancer. There is some older research out there showing that it could potentially make a prostate cancer grow faster. The newer
Okay.
research is not correlating that as much. So we're not really sure, but I do still talk about it because the older research really did show a correlation there. So I do like to talk about that. And then in regards to erections, it definitely is part of it. Erections are a lot mental and a lot blood flow, a little testosterone. So if you are, I always tell my guys, your head to head connection, very strong, very strong. So if you are stressed, if something's going on at work or in your relationship, or you're thinking about the grocery list, whatever, it's not just women that do that, men do it too. And,
The
so
honeydew list, right?
exactly, exactly. So if you're checking things off up here, he's not going to work. If you're worried because last time you didn't get a good erection and you're worried this time you're not going to be, it's not going to work. So the mental component is huge. And then blood flow. So if you have cardiovascular disease, high blood pressure, high cholesterol, diabetes, any of those things going on, you're going to have decreased blood flow to your penis. Okay. There's two good arteries that go into the penis. If there's any damage to those, you're going to have a difficult time getting an erection, or maintaining it. We might have some backflow. So there's different things we can do for that. And testosterone is one of the things that, if you have low testosterone and you're having some erection issues, a lot of us will start the testosterone replacement first and then see whether or not we also need to add on some erection specific medicine, or did that do enough to, kind of take care of the problem?
Yes, you covered so much. And, a lot of what you describe in terms of, having low testosterone sounds a lot like the female equivalent of menopause, right? Or
Yeah.
maybe we can call it menopause. Is there a
Right.
technical term for the, female equivalent of menopause? Because men go through it too. If they have low testosterone, the
Yeah.
hormones are so important in our bodies.
Hormones are so important. And no, there's not a specific term. I mean, it's hypogonadism is low testosterone, and it can be at any phase in their life. I mean, I think maybe my youngest guy that I have on TRT is 21 and my oldest
Yeah,
is in his 90s. So
right.
it's really any phase of life. You can really get benefit from it. So it's one of those things. I know I did say a lot, but I love low testosterone treatment. It is so life-changing for these guys. They come in and they're on the brink of divorce, they're on the brink of losing their job because they're tired, they're not having sex, they don't even care if they have sex, they don't care if they turn that project in on time, and you get them their hormones balanced, and all of a sudden everything's clicking and life is good again. And it's the same with women. I am not as well
100%.
versed in female hormones. I'm
Hmm.
working on my certification right now, but if our hormones are off and not well balanced, we can have lack of energy, lack of motivation, brain fog, all of the same things. So, yeah,
Exactly.
whether you're male or female, all of the hormones, we all have all of them, just in different ratios. But it's super important to get them balanced.
Yes, and I love that you talked about optimal
Yeah.
levels as opposed to normal levels, right? Because
Mhm.
obviously, as we get older, it's normal to have decreased levels, but
Yes.
that's not necessarily optimal. And if you're
Mhm.
treating someone in their 90s,
Yeah.
obviously, if they're not receiving testosterone, their normal level for a 90-year-old would be very low.
Yeah.
However, it's not optimal. And if someone wants to stay sexually active well into their 70s, 80s, and 90s, they should be looking at hormone replacement so that they can stay optimally fit in that area.
Yeah, absolutely. Absolutely. Huge proponent of it. I think it's one of the best things that you can do, male or female, is get optimized that way. And that was something that I had to learn in practice too, was when I first was practicing. And testosterone is a controlled substance because it was abused for so long. And I know I'm going to be watched by the DEA and all these things. And so I was like, nope, if you're not below 300, I'm not doing it. And then you get a little bit more comfortable and you learn a little bit more and you realize there's differences there and there's nuances to it that we're allowed to do as providers. And you really learn about optimized medicine versus following the numbers, because let's be real, insurance doesn't know shit about medicine. And so I don't want to
100%.
follow their recommendations.
Absolutely. If you're only going by the insurance's recommendations, really, we wouldn't be getting much treatment at all because they don't want to pay for anything, right?
No.
And so we
Right.
really have to advocate for ourselves when it comes to anything outside of the realm of like what insurance covers. You have to
Yeah.
advocate for yourself. You have to ask for what you want. And if
Yep.
your testosterone is, say, within the normal range, but you're 25 years old and it's, you know, 350,
You need
you
help.
need to ask. You need to
Yeah.
ask. You need to say, hey, I need testosterone. Whether you want to prescribe it or
Yeah.
not, I'm going to find someone else that does. You have to
Yeah.
advocate for yourself, and so I think that's really essential.
Yeah, and I'll just add a little caveat there because there are a
Hmm.
lot of men's clinics popping up and they
Yes.
will not necessarily optimize you. Okay. They
Okay.
will make money off of you.
Okay.
So you do need to do it safely. You should be
Hmm.
having labs checked at least every 6 months, if not more
Okay.
often. When you are changing doses, you should get them done more often. And you really want somebody who's looking at your blood count, your testosterone, your estrogen, and watching your PSA. Those are all really important factors. I can't tell you how many guys I've had come from men's clinics who are on 4 or 5 different medicines combining that are really not doing a whole lot for them. And I strip them down and their levels are still the same and they feel better because they're not getting the side effects of some of these other ones. So just do your research. I'm not saying that all men's clinics are bad because there are some fabulous ones, but just do your research, read the reviews, and make sure that it's not just a money drop, that they're really following you and treating you correctly.
Absolutely. Absolutely. Let's talk about the pelvic floor because
Yeah.
I feel like that's such a abstract idea for a lot of people. They don't really understand what it exactly is.
Yep.
How does having an issue with your pelvic floor affect your sexual health for men and for women?
Sure. So, for men, you can get chronic testicular pain. You can have issues with your erections. You can have penile shortening, just pain within the pelvis. You can also have leaking of urine, constipation, all of these things. Everything in our pelvis is so close together. And so, all of these have to be working, and you have to be stretched and strengthened. So, a lot of times, what we're seeing with patients who are having erection issues, chronic pain in either their scrotum or their pelvis, it's actually that they're too tight. They're carrying their tension in their pelvis. Their pelvis is so tight all the time. And you think if you held your bicep in a contraction, after a while, it's going to get really sore and it's going to cramp up. Same thing with your pelvic floor. If you're constantly holding it under tension, it's pinching your prostate, it's pinching your nerves, it's pinching your blood vessels, and all of those things cause pain and decreased sensation and blood flow issues to your penis. So all it's huge. So one of my favorite things is to send people to pelvic floor physical therapy. Now you can Google it and you can do some on your own. The problem with that is, number one, you don't know if you're doing the things right. And number two, when you go and get assessed, they're looking to see what areas are you over tight in, because we don't want to strengthen those areas. What areas are you loose in that we do need to tighten and strengthen? And really, like, where is the specific spot of your pain, if it is a specific spot, because how can we help that nerve? So it's really important to go and get a full evaluation and learn the exercises correctly from a pelvic specialist, because we will have people who will maybe not completely regain their erections, but they might still need a little medicine or something on the side, but they can get firmer. They can last longer. They don't have the chronic pain anymore. So it's really exciting when they can kind of like relax that pelvic floor. I just had a guy come into clinic today that I sent because he told me he's noticing his penis is getting shorter and he's only in his 40s. And just the anxious energy coming off of him today, I was like, oh, you're really tight down there. I can just tell, like, we need to go stretch you out at physical therapy. So it really does make a big difference on these guys. So for women, same types of things. We can have pain either all the time or with sex. You can have leaking of urine. You can have prolapse, which is where either your bladder or your rectum fall into the vaginal cavity, or your uterus falls down into the vaginal cavity. So those can be from pelvic floor weakness. And then, of course, leaking of urine, constipation, all those things as well. So specifically, again, pelvic floor physical therapy, go get an actual evaluation so we know where to strengthen and lengthen. But it can help with especially pain with sex is one of the ones that I love sending people for. And another tool that you can use is actually vibrators. So the research has shown that vibration can decrease pelvic pain, and there's different vibrators out there now that are considered sexual wellness tools, not just toys, that are you put on the spot of pelvic pain, and over time of using this, it actually decreases that pain because it helps the nerve let go, or the muscle that's too tight let go, just like you'd get a knot worked out in your back. So it's really cool, some of the stuff that's coming out with the pelvic floor for that. So strengthening is important, but you got to know which area of you needs to be strengthened. Kegels are not the end all be all. And in fact, sometimes they make things much worse. So definitely get the exam. But we can help with the prolapse. Pelvic floor physical therapy helps some with that, especially if it's early on. But then we also have some surgeries we can offer for that. And then there's also pessaries, which are like plastic discs, essentially, that I can put up into the vagina to kind of push everything back where it's supposed to be. And that stays inside of you. I clean it every once in a while and things like that for you, but it stays inside of you to help keep everything taut and up where it's supposed to be. And that can really relieve pain and pressure for people. So that's really cool as well. But yeah, there's so much with the pelvic floor. There's levels to it. And you would be surprised, but the muscle that goes down to and helps hold on to the guy's testicles is actually from the outer oblique muscles. So your abdominal muscles are actually into your scrotum. So when I tell you that it's not necessarily a scrotal issue in and of itself, because we've done the ultrasound, we know everything and anatomically is okay, and I send you to physical therapy and all of a sudden they start working your abs, there's a correlation, there's a reason. It's all so connected down there.
Absolutely. And a lot of times, our bodies are not seen as interconnected, right? You go to your, cardiologist for your heart and your dermatologist for your skin, but yes, everything down there is super connected. And I love that you differentiate between strength and stretch, right? So a runner oftentimes will have tight hamstrings because of the running. And so they need to do a lot of stretching so that they don't pull a muscle, right? And so it's important to get an evaluation to be able to see, are there tight muscles there? Because the tight muscles we don't want to exercise. So in other words, if you have a calf muscle that is it's spasming, right? And it's extremely painful, right? You're not going to go and do toe lifts and strengthen those muscles, right? So same thing with the pelvic floor. If your muscles are in spasm, you need to reduce that spasm before you can strengthen. So I love that you make that differentiation. And so yes, if you go online and you find pelvic floor exercises and you start doing them and the pain gets worse, stop immediately and go seek help from a pelvic floor physical therapist. So thank you for differentiating that, because it's so important. And I think a lot of times people want to find answers on their own, and it's so easy to jump online and just pop into ChatGPT, what are the exercises I can do, or look in YouTube. And yes, there's a lot of information that you can find, but you need to also understand that these exercises may not be the answer for you.
Right. And they go to extra programs. I mean, pelvic floor physical therapy is a specialty within PT. So they go to extra training for this. And I can't tell you how much I have learned from the pelvic floor physical therapists in my life. They teach me stuff all the time that I've been able to incorporate into my practice and give people tips and tricks here and there, while they're waiting to get into their PT or something like that. But yeah, it's very individualized care. One pelvic floor is not like the next.
Very true. Very true. Let's talk about penile atrophy and how men can avoid it. And then, we have the flip side of that. But let's just start with the penis first, because, then there's vaginal atrophy too.
Yeah. So penile atrophy totally happens. It is absolutely normal. Some of that is going to be just your normal aging change with, decrease in testosterone, decreased blood flow. But one of the biggest areas I see penile atrophy in is people who are not active sexually. So even if you do not have a partner, your penis is a use it or lose it. You need to exercise it. Just like you go to the gym for your muscles, your penis needs exercise too. So whether you climax or not, if that is a personal thing for you, it's not an issue, but I still want you getting an erection at least once a week, preferably multiple times a week, because we need that stretch of the elastic tissue. We need the stretch of the blood vessels, the outer skin. All of that needs to be exercised to maintain length and girth. An area that we also see this in a lot is prostate cancer treatment patients, whether it is that you had your prostate removed in a prostatectomy, or if you had hormone and radiation therapy for your prostate cancer, you're getting your testosterone taken away, you're getting decreased blood flow for a while, the radiation is doing its damage down there. So a tool that guys can use is a penis pump. So even if you are not, your libido's crashed because you have no testosterone right now while you're on treatment, or you don't have a partner right now, whatever it is, maybe you have cardiovascular issues and you can't take erection medicines, whatever. The penis pump is really great. It's just like the Austin Powers movie, but you put it on over a flaccid penis, and you want to make sure that it's a really good seal up against your pelvis and that you don't get your testicles in it, because that really hurts when you pull your testicles in. Really good seal, put that on there. They have both mechanical ones that you pump, and they have electric ones that you just turn it on and it pumps for you. But what it's doing is it's really sucking the blood into the penis. I always joke with my guys that it sucks harder than their partner can for them. So it really pulls the blood in there to help them get an erection. And, then you can use a cock ring around the erection if you want to try and maintain it to actually have intercourse or whatnot. But, just getting that exercise and keeping that engorgement on a regular basis is the best way to avoid atrophy. And then, of course, getting your testosterone checked and replacing that if you need to. But the exercising the penis is the number one way to avoid the atrophy. It's huge.
Absolutely. And same
Mhm.
goes for women. If you don't
Yes.
use the muscles, right? Because the vaginal
Yep.
walls and the pelvic floor, it's all muscles, right? So
Yep.
if you're not exercising those muscles on a regular basis, you're not going to, continue to have the same tensile strength in your muscles,
Yep.
and you're not going to continue to have the strength in order to have a healthy sex life. So important
Yep.
to exercise. And I love the recommendation of the penis pump. I just had
Mhm.
Sam Itzaki on the show last week, and we talked about a specific penis pump that he recommends that has 4 different sizes. And I think that a lot of times what happens is when people try a penis pump for the first time, if it's not the right size, right, the testicles
Mhm.
can get sucked in and can be very painful.
Yep.
And the first experience is the experience that you're going to remember forever, right? And so you want the
Yeah.
first experience to
Yeah,
be a
and
good
I will have
experience.
my guys Yeah, I will have my guys bring it in. We'll work on it in the office. I have no
Mm-hmm.
problem with that if they want me to
Right.
help them with that. And a lot of them, even if the cylinder itself doesn't come in different sizes, a lot of times they'll come with different rings for the opening
Mm-hmm.
of the cylinder to help prevent the testicles getting sucked in. But yeah, it's really important. If the first one doesn't work, try another one. Probably don't return it. I don't think they really allow that for penis pumps, but you know. And there's medical grade ones, there's cheap ones. I always, I'm like, go on adamandeve.com and read some of the reviews because first of all, they're hysterical. And second of all, you can find one in your price point that maybe you'll like, or, any of these other stores and online places. You can at least read about them and then kind of determine which direction you want to go with your purchase.
Yeah, absolutely. And I really love the idea of having the different sizes, because
Hmm.
when you do the ring itself can cause a decrease in blood flow. And what we're trying to do is increase that blood flow, right?
Hmm.
So the different sizes can, help you to be able to grow with it, right? Too.
Hmm.
And so it can also help you to not get that penile atrophy if you're
Hmm.
constantly using it on a regular basis. And when my patients come to see me for erectile dysfunction, that's the homework that I give them. Use the penis pump every day.
Yeah.
And most men don't want their penis to atrophy. So if they know that
Yep.
is going to happen over time with age and with lack of sex, right? Because,
Yep.
in relationships, you may have, sex once or twice a week. That's what about the other 5 days of the week that
Right.
your penis is not, filling up with blood? You need to practice that over and over. So let's talk about vaginal
Yeah.
atrophy and what sorts of things that can cause.
Yeah, I mean, so vaginal atrophy, we see it exponentially after menopause, right?
Mm-hmm.
You can see it if you have delayed puberty in your postpartum phases, different phases of life, different medicines you might be on, things like that. The vast majority of who we're talking about, though, is postmenopausal women. As we decrease our estrogen production and get to zero estrogen, we will see a reduction in the external labias and the internal labias. They just get smaller. Sometimes they get almost non-existent. I've seen women who basically look prepubescent, as they get older, just very no labias. So that's one thing. And nobody told us about that, by the way. Nobody told us that was going to happen to us. So some of my
Right.
older ladies are like, what is going on down there?
My
um,
vagina just shrunk.
right, right. And then it thins all the tissue. So your vaginal wall, your bladder wall, so frequency and urgency are common symptoms post-menopause just because of the thinning of the wall, not because all of a sudden you have overactive bladder. The thinning of the vagina leads to dryness, so less lubrication on a daily basis, and when you're trying to be sexually active, less elasticity of that tissue. So when you're trying to take something in a penetrative manner, it's maybe more painful, maybe more difficult. Maybe you can't take the same size you used to take. And then also, recurrent UTIs become a big issue because that tissue is not getting as much blood flow. The lubrication isn't there to push the bacteria away, and those tissues are thinner. So you can get more infection infections. Also, our vaginal pH is thrown off a lot easier as we get older, and that is supposed to also help protect our urethra because they're so close. Some women, their urethra is inside their vagina. And so if we're getting all of those protective mechanisms thrown off, then we're really susceptible to infections. So my favorite thing is vaginal estrogen. Let's put it back there. It needs it. So we put a little bit of vaginal estrogen in there. There's different ways. There's creams, tablets, different things like that. But from a urological perspective, because I want to prevent UTIs and those things the most, I like to use the cream. It comes with a plunger. I say throw plungers away. Plungers to me are gross and you can never get them clean enough. So I like a good clean finger, blueberry size amount on your finger, and then you rub it between your labias and inside the vagina as well. If you only do inside the vagina, you're going to get some results, but not as much for the UTI prevention and the external area that we also want to be nice and lubricated and stretchy. And then getting it inside the vagina really helps with the stretchiness for sex and decreasing that pain associated with sex. Some women, it will bring back enough lubrication. Some women will still need to use lube when they're having sex. And no woman, regardless of age, should ever feel bad about asking to have some lube down there because you don't want to hurt. You should not hurt. You should be able to be supported with whatever you need down there while you're having sex. And then, of course, exercise, having sex, getting orgasms, masturbating, however you come to climax and get the extra blood flow going down there also helps keep the tissues nice and healthy.
Absolutely. I was going to get into all of that on the second part. So I'm
Sorry.
going to ask you, that's okay. That's fine. So I want to kind of expand on that on the second part though, because I do want to talk more about estrogen, but I do also agree that, having topical estrogen is so key. So we'll talk about that on the other side. I want to make sure that my listeners can find you. And so tell us where we can find you.
Sure. So I have my own podcast, Between the Sheets. So anywhere that you listen to podcasts, and your host, Eve, has been on there. So that's very exciting. You can catch her over there as well. And my website is betweenthesheetswithdrz.com. And then my handle on all the social medias is Between the Sheets with Dr. Z as well. So you can find me TikTok, Instagram, Facebook, all the fun places.
Okay, Between the Sheets. Check out our show too. It's a lot of fun. And check out my episode, when it comes out.
Yes.
Absolutely. So thank you so much for being on the show. And I can't wait to jump into part 2 because we're going to really expand on this information that we sort of started talking about already. So until next time.
Bye.
I want to personally invite you to join me on Patreon for ad-free listening, bonus episodes, and early releases. Already, there is a lot of bonus content on there with many webinars that I've done in the past and a show that I've never released to the public before. My show is completely self-funded, and when you are able to support me in this way, I'm able to spread my message of body positivity, self-love, and women's empowerment, and empowerment in general around sexuality around the globe. And so with that being said, I appreciate everyone who has already joined Patreon. And if you've thought about joining, now's your nudge to do so. I thank you from the bottom of my heart.